So these two concepts are concepts that have been confusing students for a while now. All right, so me too. When I started my ECG classes, they actually gave me some tough time. So I just say like, okay, when I understand it, I'll do some videos on it. All right. So this is a concept of P pulmonale and P mitrale. So we are just trying to look at the differences, right? Like the differences between P pulmonale and P mitrale. The two of them have to do with what? Atrial. All right. It has to do with what? Enlargement of the atrium. Okay. So now, first of all, I want you guys to get the differences on the sides. P pulmonale is usually what? Related to the right atrium, while P mitrale is related to the what? Left atrium. Okay. So there are some criteria that you can use to confirm if there's an enlargement of the right atrium, and you can also use it to confirm if there's an enlargement of the left atrium. Okay, so that's what we're trying to look at. So this P pulmonale, you could say this is P pulmonale, this is for P mitrale. Can you see how the P pulmonale is looking straightforward, like a triangle, right? While the P mitrale is looking like an M. Can you see the difference between the shapes? Okay, how it to look like. So let's look at the differences. We'll talk about P pulmonale first before we talk about P mitrale, right? So the P mitrale and P pulmonale are what? Electrocardiogram findings that indicates that there's a change in the P wave morphology. There's a change in how the P wave should look like, right? And this is suggesting an underlying cardiac or pulmonary condition, right? So this is how a normal P wave should look like, all right? Just like a little deflection, right? But when you're having the P wave looking like a triangle, RB is looking like an M, then there's a problem, right? So for the P pulmonale, you have a tall peaked P wave, which is usually more than what? Can you see? Usually more than what? 2.5 millimeters in lead 2, right? And this is indicating that there's what? A right atrial enlargement or hypertrophy, all right? And it's often associated with what? Pulmonary hypertension, cor pulmonale, which is a right heart failure due to lung disease, is usually associated with what? Chronic obstructive pulmonary disease, usually associated with what? Pulmonary embolism, right? That's P pulmonale. Now, how about P mitrale? This one is a broad notched P wave, which is more than what? 0.12 seconds in lead 2, indicating left atrial enlargement or hypertrophy. So this one, can you see that it is broad? It is broad and it is notched, right? It's a notch, all right? There's like a pressing on the P wave, okay? And it's usually more than what? They said that it's usually more than 0.12 seconds. And this one indicates what? That is a left atrial enlargement. You get P pulmonale was for right, P mitrale was for left ventricle, left atrial enlargement. It is associated with disease conditions such as what? Mitral valve disease, left atrial hypertrophy or dilatation, heart failure, and cardiomyopathy. Right? So on this basis, at least you guys will get to what? Know the two concepts individual and also get to know the differences. It's just like I made a video to kill two birds with one stone. One is more of like I'm talking about P pulmonale and P mitrale differently. Then the other one is like I'm talking about them together, trying to differentiate them. Okay, so that's it about what the differences between P pulmonale and P mitrale.